Today, I'm going to talk about the whole day. And I think we can all agree the whole day matters. Matters how much physical activity you get, matters how much time you spend sitting, also matters how much time you spend sleeping, and if you have regular bedtimes and regular wake-up times. In general, these have been treated as separate behaviors, but we know they have benefits for many different things, including mental health and physical health, including weight gain and also cognition. Now, these behaviors are very interesting and unique. They're exclusive and reciprocal. So unlike, for instance, physical activity and diet, where you could be conceptually walking and eating a taco at the same time, you can't be running while you're sleeping. I'm looking across the room and I don't see anyone sleeping while they're sitting, so we're good to start there. But they are exclusive. You can only be in one. They are also reciprocal. So the amount of time you spend in one will influence the amount of time you spend in the other. So in general, we can say that if you are physically active, you are more likely to have better or longer sleep that night. There is some evidence that better sleep or longer sleep might make it easier for you to be physically active the next day. But again, these are very interesting behaviors that all happen within the 24-hour day, and I think we can all agree that they're all important. But my background's in childhood and in young children, and we've always thought of these as separate behaviors. So for instance, we have guidelines or a consensus, at least for 3 to 4-year-olds, of how much time they should be active, including in moderate to vigorous physical activity, which is exercise-like intensity. We also have separate guidelines from the National Sleep Foundation that emphasize not only duration, but sleep hygiene as well. And specific to young children and even just children in general, we have guidelines for the amount of time they spend sitting and watching screens. I want to bring this up because we technically don't really have those for adults. We have some guidance that has come up in the last couple of years, but right now I can't tell you you should only be watching your screens today for 6 hours. That's the recommendation. We don't have those for adults. But again, in order to make some of these consensus and guidelines, we have to review the literature and see where the literature finds a health benefit from meeting certain amounts. And these are United States guidelines. When Canada was doing their guidelines about 10 years ago, they were reviewing the literature for physical activity and said, hey, a lot of these studies have screen time in them. And then when they were doing their sleep research, they were also saying, hey, screen time's in this one as well. They said, instead of making 3 separate guidelines, let's just make one big guideline and have 3 behaviors. So again, this happened around 2013 or 2014. They finally released them in 2016. And so we like to say that's when the conversation began, and began from a Canadian group releasing this 3 behavior guideline. Again, we didn't change the numbers. They're just all together in one guideline together, the 24-hour movement guidelines. And the emphasis is really if you're going to change time from one, where is it going to the other? And what we found in early reports is that very few young children met these guidelines. So in general, we can say about 15% of 3 to 5-year-olds meet all 3 guidelines. This in general keeps getting worse as we get into 5 to 17-year-olds. About 5% of 5 to 17-year-olds will meet all 3 guidelines. But we do know that meeting all 3 behaviors is associated with fewer behavioral problems, very important for parents and those who care for young children, motor skills, and it's mixed on obesity. I want to emphasize, and those who work in children know there's many transitions between 0 to 18, so I think it depends on when you're assessing it. And just for this group, I just want to emphasize, and maybe this isn't new to any of you, that motor skills are incredibly important. So if you might have heard the term, it's like riding a bike. Motor skills are something you learn. You can't really unlearn them. So this is throwing a ball, skipping, dribbling a basketball. It's really important to learn these early on. Having better motor skills leads to your better chance of being physically active later on. So achieving moderate to vigorous physical activity. But this is actually a bidirectional relationship, because the more exercise-like intensity you get, the better motor skills you'll have. This is really important that we get these before 5. What we see in our Louisiana studies, actually very few kids achieve these standards. So if you were in 3 to 5 years old, you probably can think about how some kids haven't learned to do a basketball. And it's actually really hard for 3 to 5-year-olds. It's really hard. Doing a basketball, throwing a ball, and these are gross motor skills, but also pertains to fine motor skills. So we think about putting a penny in a bank, some of these other things. We need to learn these early on that can help them later on. And what we also have found in some of my early work is that all 3 behaviors, not just physical activity, impact your gross motor skills. So the amount of time you spend in screens and your sleep. So it's not just getting physical activity, it's decreasing that sedentary screen time and lengthening or getting better sleep. But again, this is 2016, and right after 2016 was actually a very small group. Again, there were only about 51 studies. So in the research literature, this is actually quite a few people looked at 24-hour movement. In 2019, I remember I went to a big national conference. I'm so excited to talk about this. It was adopted by Canada and a couple other countries, hasn't yet come to the US, but I just remember very few people knew about it. But then 2020 happened, and 2020 was actually a really big year for us in 24-hour movement. We had the guidelines adopted, we had for young children, and then we also had some guidelines for physical activity and sedentary behavior adopted by the World Health Organization. So they said, we deem these as guidelines that we should enact public health initiatives for children to meet for better health. However, I think a lot of us see 2020 and think of it a little differently. There's something else that happened in 2020, and that was the COVID-19 pandemic around March 2020. And as we saw macro system changes to our full day, we also saw physical activity change and the amount of time we spend watching screens change. I think in general, our sleep shifted. And so we went from very few people meeting all three guidelines to, well, it getting a little worse. In those early studies, we found that kids had less physical activity, more screen time. Their sleep might not have increased. And so some of our wake times and bedtimes might have changed a little bit. And we also had an explosion of research. So a lot of physical activity researchers said, I'm seeing changes in physical activity and things are moving. What about this 24-hour paradigms? Went from a very small field to about 150 studies within 1 year. And some of us who do research know within a year to get a study published, that is quite quick. So there is even more. So if you were to search the literature right now, I would guess you probably have 2,000 studies within 8 years. So it's been a huge explosion. Within this, there's also been something that I would be remiss if I did not discuss, and that is the proliferation of wearables. So when I say wearables, I'm talking about Garmin or Apple Watches. Does anyone have any of those on by chance today? Raise your hand. So we have about 50 or maybe 60% of people wear them. About 4 or 5 years ago, it was only 25%. So we are having not only more people having data, but these, what do they collect? Physical activity and sleep and, some sedentary time as well. So we have these devices that are able to measure, I would say, physical activity and sleep, and there's a lot of them. What I'm showing you here on the side right is that there's a lot of different devices. We have research grade, we have Fitbits all together, and it's kind of created a little bit of a conundrum. I'll just say that there's a lot to exist. There's a lot of places you can do it, and it depends how you want to use it and for what. And so it's really opened, I'd say this like Midwest can of worms. So it's really contributed though to our interest in 24-hour movement because people have this data. What are you going to do with it? And so to bring it all together, we went from about 8 years ago, these being separate behaviors, kind of separate camps, sleep, physical activity, and then maybe the screen time individuals as well. But now we're kind of coming together because of these series of events that have happened over the last 8 years. And bringing it to 2024, I actually was reviewing some literature recently, and we just published an umbrella review just to kind of update us on where the literature is. And what we're actually finding is that our early estimates of COVID-19 are kind of staying. So we are still finding, and what I'm showing you here on the top right, very few kids meet all three guidelines a couple years post-COVID. We are also finding that it's mainly driven by high screen time, and then our physical activity and sleep is still not ideal. On an anecdotal note, my research over the last 6 years, we are seeing a screen time shift. So there's a lot more screen time than there probably was before because of some of the changes as well. But again, it's kind of stayed across. The other thing is it gets worse as kids get older. So our 5 to 17-year-olds, maybe again, 5 to 2% meet all three guidelines. And in infants, maybe you get 15 to 20%. So there's still a need, and that's what I'm really going to talk about today, is that there's still a need, and also how can we address this? So today I'm going to first talk about the first 24-hour movement intervention in our program. Again, this is my work in the home environment. Then I'm also going to consider some programs for special populations and talk about 1 to 2-year-olds and gardening in 1 to 2s. It can be done. I will show you. And finally, I would be remiss if we're only talking about early childhood. We know that things happen after 5, and I'll talk a little bit more about some of my other work across adolescence and a little bit about pregnancy and postpartum as well, which is also an important time. So I use the term, where's the time go, as part of this presentation to use it in a couple of different ways. First, thinking about our whole 24-hour day, where are we spending it, but also thinking about the importance across the lifespan. I'm not going to speak too much about childhood obesity today, but just know that a lot of these things that happen in that first 2,000 days really set you up. So we know that kids who have, for instance, obesity at age 5 are 4 times more likely to have obesity at 18, and obesity at 18 is cancer at 35. So today we're really thinking about how it all comes together. And again, I'll first start with the home in 3 to 5-year-olds. So, and then I'll transition part into school and transitions. So as an overview, I'm going to talk about the home environment, how it's been an untapped area until probably the last couple of years with COVID-19. I'll highlight the importance of family members, household organization, and also how we would have to, focus on all three behaviors within the home. So I have to start with a personal story of how I kind of got into 24-hour movement behaviors. So many years ago, when I decided to do my dissertation, I was in a nutrition department. We did a lot of work in families and childcare settings, and I was trying to figure out a dissertation topic. And one question I had was we're looking at families, but I noticed that not many people look at the sibling. Is having a sibling important to health behaviors? I went to my mentor, Dr. Susan Sisson, and she was like, there's done some research, but we haven't really looked into it. So I started to look into this literature, and what I found was that singletons, so this is kids without siblings, actually have higher rates of obesity as early as age 6. So something is going on those first 5 years. And I said, well, would that really be the health behaviors? Is there other, contributors? And what we found in literature was that some evidence that would support having siblings is related to better health behaviors, including diet and physical activity. And so my dissertation was called SISPRO, Siblings' Influence on Subsiding Behaviors Related to Obesity. So I looked at kids with and without siblings and said, do they have different physical activity and diet, which again would be contributors to energy balance and obesity development. And short and long as we did, we found that singletons had higher rates of obesity, as we saw in past literature. I think the exciting thing was 7 times more kids without siblings had obesity than kids with siblings at age 5 or 6. We also found that kids with siblings had more family meal practices, better health quality, and physical activity and sedentary screen time. And as a part of my dissertation, I went into all these homes. So there's about 75. And something that really stood out to me, and something you couldn't put in a manuscript, is the families with one child tend to reschedule a lot. Does anyone here know about people rescheduling on them, or maybe having to redo a clinical visit? Maybe heard of that a little bit? Yeah, so it stands in your mind, and it was a lot. And I just thought, at the time, I didn't have lived experience with small children, so I was like, so that's interesting. You think the family with 2 kids would have all these schedules, and the families with 2 kids, it was like rain or shine. It is happening today. I remember I drove through a rainstorm to a sibling household. So this is the only day of the week it will work. So I was like, that's really interesting. This kind of goes against a resource hypothesis of time and money. And so I was like, maybe it's not the sibling. Maybe it's that families with 2 children tend to do something else in general than families with 1 child, because there are single children who have healthy behaviors and healthy weight gain. And so I got into this idea of household chaos. So household chaos, though some of you might have your own personal definition of household chaos, it is defined by 3 pillars in our measure in the literature. This is disorder. So this is maybe things not aligning. It could also be messy households. So you're having trouble finding things. Crowding. Crowding can be number of people or a smaller space for a lot of people. So it's not always the number of people, but also your space as well. And then noise. Noise is usually having the screen on, so having to concentrate with other noise or people talking over each other. And so when we looked at the literature, this has actually been investigated a lot in especially kids with type 1 diabetes, because household chaos may impact their ability to receive or do their medical care and take care of their diabetes. But we also found it was associated with more screen time and sleep. And I'm a physical activity researcher, so I was like, well, do you think it has any contribution to physical activity? And so we started to have that question. And what I like to do with my research is, what is the solution? So not only what are we finding, but what would be the solution, or what would I tell a family? And so what had been demonstrating in the literature is family routines and bedtime routines specifically. And I'll talk a lot about that in a little bit. And so we started a study in March 2020. We had to pause it for just a little bit. And then we brought it back up in May 2020 and investigated household chaos during the pandemic, and found that household chaos associated with all 3. It's great. That was what our hypothesis was. But having these bedtime routines or routines within the home really didn't change any of that physical activity. And so it really made me think, well, what are some other contributors to kids being active within the home, and what can we really do to support those families? Which led to, I guess, my next study. It's called Indoor Active. And so I was like, well, if we were to support families, I would like to know what you could do in a real living room, like a true 6 by I think it was 12 by 18 living room, kid by themselves. How could a kid be active? Just how could you achieve moderate to vigorous exercise like intensity? So we did this study called Indoor Active, where we had 3 to 4 year olds go through a series of physical activities and saw if they could achieve exercise-like intensity. We call this MVPA. And we actually found that 3 activities got to this level. So that would be ball skills, and this is a fancy word for keeping a balloon in the air. A stationary cycle, so kids Peloton, and doing circuits. Now the circuits did get the most activity, but the kids were really tired and they didn't like doing it. So if I were to take anything from this slide, Bluey got it right. It's just keeping a ball in the air, keepy uppy. And that was the #1 thing that kids really liked. The other thing we saw is that we actually staggered the activities by screen and non-screen, and there was no difference in the amount of physical activity. So you can be active with the screen. Some of you see dancing on there. I can talk about that a little bit later, but I just think dancing is not a vigorous activity at this age range, but it can be achieving some of this exercise-like intensity. But bringing this all together, we're finding some things for screen time and sleep. We're finding some things for MVPA, and that led us to this idea of a first 24-hour movement program. Now, we know the house is very complex, and so we decided to create more of a multifaceted program that incorporated household organization, our family members, and some of that preliminary data. But in order to get to families, really need to think about how we're going to get it within the moment. And we thought of using an mHealth app. So an mHealth app is pretty much, an app on your phone. And if you think about it, most of these are geared towards older children, older children or just parents themselves. So we decided to create our own app for young kids. Before we did that, though, we really wanted to get a deeper dive into what's happening within these families who don't meet the guidelines. So that's either high screen time, low physical activity and sleep, or for instance, long sleep and high screen time. So we did this thing called ecological momentary assessment. So you complete daily surveys to get an idea of what happens on the day-to-day rather than just one questionnaire and seeing how it relates to things. So they did daily surveys. The first survey that they did was in the morning and was to report what you did that night before. And so what we were interested in is, this bedtime routine. This is like, the thing that's going to change both behaviors. And we were thinking that families who had high screen time and short sleep wouldn't be doing it, right? Because that is the one thing. Well, these families are actually doing it. A lot of these families who have high screen time and short sleep, they're doing bedtime routines. The big thing is screen time is a part of that bedtime routine. So as a practitioner, if someone's having trouble sleeping, if the first thing you say is, oh, you should create a bedtime routine, they're going to say, I'm already doing that. What else do you have? And so we really start to look at screen time as part of it. And for a contextual example, we did some interviews with them. The example would be we do bath, we'd watch some TV, and then we go to bed. And so that screen time is tied to that sleep as well. We also learned that a lot of these kids are waking up in the middle of the night. And so sometimes it might not be when you go to bed, it's that these kids are waking up in the middle of the night, and that's what's really shortening their sleep as well. And that was related to less sleep in general. Now, the next thing we looked at is what kids are doing within the day. So we also sent them surveys within the day to see what are kids doing during the day related to physical activity and screen time. And what we found that being with others was the biggest impact into how you were active. So one of the things I want to emphasize here is 30% of the surveys were screen time. Now, that could be because when your kid's sitting watching screens, it's easier to complete the survey. But a lot of these were screen time, and most of this was sedentary screen time. This comes up a lot when we talk about screen time as well as it's sedentary. What else could they be doing? And in this sample, it was mainly sedentary. Now, luckily, we had done that pilot, so we have some opportunities to make that screen time more active, but this is a real area to think about how we can change it. But in general, if we're with others, we're more active and we're less likely to be sitting. So bringing all this together, we had all this information. Our next step was to make an mHealth app. And so we developed an mHealth app with 4 focus groups. The goal is to see what would you like in this app and what sort of information would you like to obtain. And so we had this idea of all these like fancy, models. We're going to do this, 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 this. And they're like, let's take all that back. We just want to learn about sleep. We just want to learn about sleep and why it's important. And a lot of parents said they want like a pregnancy app for 3 to 4 year olds. So that's what they kind of want, those pregnancy apps where you like track, et cetera. They also wanted short lesson plans. I don't know if it's a surprise. People wanted something very short and some other gamification. So as they engaged in the app, they would get more rewards or more points. And so as a part of this, we also developed such app, and we're actually refining it right now. And so that's actually led to the ROO that was mentioned previously that I'm bringing with me is this study that's called Shining Star. The goal is to create this mHealth app or really deploy it and see if it can improve 24-hour movement behaviors in young kids. The goal, it's informed by some theories of habit formation. So we're putting in some specific behavior change theories and mechanisms of action to hopefully improve it. And our goal is to really increase the amount of guidelines people are obtaining. This is also coming, this will be a shameless plug. I'll talk about this a little bit later, but we're hoping to open it in the next month. So please let us know if you're interested or, would like to learn more. But again, I've told you a lot about the home and how it impacts 24-hour movement behaviors. I've told you a little bit more about how we're testing an app and really just thinking about it's not one thing in the home, it's all things coming together. But today I started with the creation of the first 24-hour movement intervention. We know that that's not the only place kids spend their time. So I'm going to transition into the school environment and actually go a little bit younger today in 1 to 2s. So the thing I want to talk a little bit more about is physical activities for everyone. 1 to 2s, I think maybe some people in this room are like, 1 to 2-year-olds need activity? Yes, they do. It actually is really important, especially we've found that there's actually a huge screen time increase between 1 to 2, about 1 hour per day. I have no screen time at 1, and then at 2, we actually have 1 or 2 hours. So we're already exceeding the guideline coming into 3. We know that most toddlers spend their time in early childhood education settings. There are a lot of settings for kids to receive care below 5. I'm going to talk about childcare centers. So that's an example is like kinder care or like New Horizons. So kind of a structure that's meant for childcare rather than having care within the home, which is more of a family childcare home. And what we found actually in Louisiana is that a lot of these centers don't meet all the standards. So for physical activity environment, training, and practice as well. And I want to emphasize this because as you may know, the outdoor environment matters. It matters how much pass for wheel toys you have, how many places you have, as opposed to just an open field. It matters for your physical activity. I know I'm talking to a physical activity audience, but you think about the amount of time they go into designing parks, designing all these other things is to facilitate physical activity. Now, intervention research or any research in early childhood is not new. If I were to classify it into 3 categories, I would say it's increasing the amount of time you spend outdoors, adding a play structure, or maybe even teacher training. These have all resulted in some effectiveness. I think some of us can think about this a little bit more. Increasing the amount of time, you have to manage 100 kids and all the other classes, so it's not always feasible to change the amount of time people spend outdoors. Adding a playground is about a $20K investment, and you have to close the playground, you have to figure out which playground you're going to do, and there's a lot more that goes into it. And then the teacher training can be very helpful, but we also know that there's teacher turnover, and how do you maintain that consistent training over time? The other thing is that most of this has been in 3 to 5-year-olds. And as some of us who have lived experience or work in this age range, they know 1 to 2s are not 3 to 5s. And so toddlers need programs at their level. The biggest thing I want to emphasize is toddlers can't climb, and we have a lot of safety concerns. So maybe some of you have seen like young kids do those bigger playgrounds, and it's not really ideal for their abilities. But nature might be right at their level. When I use the term nature-based learning, I'm thinking about using children's natural interest in nature. So things that are natural, like if you've ever been to a park and you just naturally want to go to certain areas or check things out, kids have that really young, and it's also really a lot more cheap, and it actually fits what they're interested in. There's also no climbing in a lot of this. So safety concerns are hopefully there. We've also seen this actually improves their social development and also some of their mental health as well in kids with those needs. Now I have some examples here. This might be a garden, this might be having shrubs, and it might be also a nature table. And so we decided, and I want to take a quick moment that this idea actually wasn't really mine. I was really interested in nature-based learning, and I had the fortune of working with a community partner, Dr. Michelle Grantham-Caston. She was a director of an early childhood center, and we were talking about things. And I was like, I want to, have you ever done nature-based play? And she's like, yeah, that's pretty cool. I was like, we should do something in 3 to 5-year-olds. It would be amazing. And she was the one who said, hold the phone. We got enough in 3 to 5. Let's go 1 to 2. And I was like, you want me to do a study 1 to 2? And she's like, trust me. And she was totally right. So I just want to emphasize that a lot of this was because I had an amazing community partner, and I want to make sure that research we're always talking to the community partner, because this made it a lot better, and it was a lot better study overall. And what we decided to do is get 2 types of information. Are people interested in it, and does it work? So when we want to do our intervention, we had a couple different items, and I want to show them because I'll talk about them later, and it's hard to think about them. The first thing we had was wood stepping discs. These are called tree cookies. Pretty much you cut a log, and their circle is about this high. It's about 1 to 2 inches off the ground. You put them out there and kids can move them around. These are all also pictures from our beta test. Anything we did, we beta tested in a center before we put it in there because we want to make sure it worked and all of our procedures were appropriate. We also did a tire garden. We are in Louisiana, and if you may know, Louisiana experiences hurricanes. And so sometimes we actually have to move these gardens. And so we didn't want to do anything permanent in case there was any flooding or anything that would have happened. So we did tire gardens, which were, I guess, cost effective, and the toddlers can actually dig in the dirt. So your 1 to 2 year old, I actually tested this with my own 18-month-old, and she actually really loved it. There is certain guidance you may need, but they really loved it, getting into the dirt. Everything was non-toxic and child-friendly. We also provide them an outdoor play and learning module. This is based on the Go knapsack recommendations for evidence-based practice. We also gave them a nature table. The nature table is basically a water table, but you put nature in it. So it's a table where you can pick up nature and go and look at it, explore it. You might have a little magnifying glass and like look at it. What the teacher ended up doing is getting like fake bugs and putting fake bugs in there. So they would like find the fake bugs. And then we had some stencils that you could use on the like the concrete as well. And so what we did is we interviewed people and saw if they would be interested in this, and surprise, everyone was interested in nature-based play, especially for 1 to 2. They did want a variety of age-appropriate items. So that was something that we considered for our next steps. But the biggest thing was finances and teacher support and capacity. So as one of them said, it always takes something called money, honey. So as great as this is, it's important to make sure this is cost effective. And so, and also thinking about how they're going to implement this is the same as implementing any change in their center. So are we going to have to close things? How is this going to change our capacity as well? Here, what I'm showing you is that we surveyed people across the state of Louisiana. And so what we did is we tested it. But what we want to do is not just put everything in and come back 3 months later. We actually implemented each item individually and came back and saw how they used it. So we could see kind of the progression of interest. And so we did find it was feasible and acceptable. They loved it. The number one thing was the wooden stepping disc. This was like $30 on like Etsy. The wooden stepping disc, they kept playing with it. It was something that was a portable play item that kids could keep moving. The older kids wanted to use it. And we're like, again, similar to indoor active, it's these simple, more cost-effective things that we're most interested. They also used it for up to 6 months. We also did this during in 2021 in Louisiana, we had the pandemic, a hurricane and a hurricane at the same time. So we actually got our nature table about 4 months late, which allowed us the opportunity to come back and see if they were using it 6 months later. And so they were still using all the items, which was really interesting to us because we thought they were, that we weren't sure how they were going to go. Only thing I will say is that we decided to do a stencil with spray chalk. Just in life, do not use spray chalk in anything. The kids just played with it and then they kept putting it on their clothes. And so we're like, what were we thinking? But at the time you couldn't spray paint onto the center. And so that was our workaround. So just biggest thing, never use spray chalk. Just stay away. It's not worth your time. We do love chalk though. So, something there. I will say something from the other side is directors all agreed that toddlers were already active at that age range. Yeah, they're totally right. So the kids are already at 90% of their time was physical activity. And so I was like, well, we didn't find effectiveness, but they really liked it. So this is really interesting because in 3 to 5 year olds, they are not active when they go outside. And that's because they might be doing other sedentary things that are important for development. But again, we're at this point with this study, and it was a really fun study to do. And I really want to credit that to, again, my community partner for, really helping us make this like the best study possible because, well, we found people liked it, but kids are already active. So we can't really change physical activity. That made us kind of think maybe we should go back to how we can improve 3 to 5 year olds. So is there other ways that we could improve maybe their physical activity beyond just inputting that playground, thinking about how we can enact policies, systems, and environment. And these policies, systems, and environment can kind of stay beyond, for instance, teacher turnover. And it's not only teachers leaving, but for instance, if a teacher were to go to another classroom, that we have a new teacher, so they can't really go back to the other teacher and ask how to use things. And thinking about how some of those bigger changes can impact toddlers and physical activity in preschoolers. Now, I know I've talked a lot about Louisiana, but I appreciate I have some co-authors here. And we actually did look at some best practice scores in Kansas and Missouri using a survey of EC providers. And what we looked at a couple different best practices. And what I'm showing you here is kind of their score. So maybe 0 to 100, 100 is, an A, meeting all of them. And we actually found that there were no differences by state or region, but there was a significant difference in outdoor play score based on whether they were a center or in-home daycare providers. So those who are actually in the in-home daycare had better outdoor play practices. So within our area, there might actually be a need to go back into early childhood center-based care and improve the outdoor play practices. And within that, some of the individual best practices we looked at were some areas to improve in, again, centers were time outdoors, some of the outdoor play environment items. But the big thing is, though, even though we're improving EC centers to get up to family childcare homes, we still have kind of low scores in training and policy, and actually family education is a best practice. So providing, for instance, worksheets or other things to parents for them to be active at home too. So all this is to say that we have many paths forward with toddlers, with nature and programs, as we brought some of our work in Louisiana here, and other interests as well. So the other thing I've thought about too is there are other programs that focus on 3 to 5 year olds in this age range, or 3 to 5 year olds in this area that we didn't have in Louisiana. And so how we can work together to improve those practices. Just a reminder, most of these kids spend, 8 to 9 hours in these places of care a day. So it's a very important place. But again, main thing I want to get to, and I think you've kind of seen in both of these, is some of these real world solutions can help everyone. So thinking about what's practical, what's cost effective. Our intervention actually only cost $1,500 to do. So it was, and the reason why we chose that number was because that's the amount of grants that Louisiana Department of Health gave. So you could get a Louisiana Department of Health grant and create our program. Again, we still have to change this chalk thing, but it's still available. But I've talked today about the creation of 24-hour movement intervention in the school. I would be remiss if I didn't remind myself that kids do something else after 5. And so I wanted to take a brief moment to talk about some of the stuff I've worked in adolescence. So first, and we'll talk just a little bit about some other transitions. So there is a classic transition of 24-hour movement in the first 1,000 days. And when I actually did my training, I went from a lab that was child physical activity to a pregnancy lab. And, it wasn't until then that I really thought that is the classic transition of all 3 behaviors. You could say in general, our physical activity goes down, our sedentary time goes up, and your sleep definitely changes across pregnancy and postpartum. Unfortunately or not, a lot of people actually follow the same trajectory. So we really need to increase that physical activity early. But that postpartum period is actually very important. What we've looked at and what we found is that there's a lot of changes in mental health and physical activity. But if I were to characterize it overall, it's the changes in mental health precede any changes in activity. So if you're to do any PA program, you really need to focus on improving their mental health and their physical health. Then people will be able to be active and sleep better. But trying to change the behaviors first isn't going to really move things forward. I also want to emphasize that it happens different for fathers and mothers based on paternity transition. So we found that this is really important early on for mothers, but it was actually more important later on for fathers. So thinking about that as well. But there's also another important transition in adolescence. And this was actually the first thing I did when I came to, one of the first things I did came to Pennington is I wanted to work in adolescence. And we actually did a lot of work in video games. And it's been used as a typical target for, improving physical activity. But if I were to, the biggest thing I learned is, do you know who the #1 user of video games is today? Does anyone know? No? No. Is anyone here a male? Anyone here a male? Want to represent male? Are you between the ages of 35 and 45? Do you play video games or anything like that? Well, you would be the typical target for video games. It's actually not a child thing anymore. I think 10 years ago, we were all like, oh, it's video games, but the typical user is a male in 30s to 50s. It's not actually a child. And so, it's like, oh, swing and a miss. And so the next thing I said is, well, maybe it's not the device. Maybe it's when they use it. So we did a lot of work in nighttime screen time, and we categorized people onto no screen time, cell phones, and a couple other things. And that's what I'm showing you here on the upper right. And the short and long is that we saw changes in sleep, for instance, in the primarily cell phone and the TVs and portable devices. But once you account for the age of the child and their sex, it all goes away. So when we're thinking about these screen times, it kind of all goes back to your preferences as identifying as a male or identifying as a female and how old you are. So younger kids have no screen time. So that might be what's influencing their sleep, as opposed to an older boy who is, 16 or 17, has very different screen time. So really thinking about age and sex is probably more important than what screens they're using. But in general, if you can limit that sedentary time, we will actually see improvements in mental health about 2 years later. So any ways you can improve that sedentary time. I will say that if you can get that moving target, when I said moving target, they gave me curling. And so it's like, that's appropriate. It's a cold day. So, but it's a moving target for screen time. But any way you can reduce that sitting time, you're going to see some benefits, especially mental health. But the other thing I want to address is that there actually is a natural 24-hour movement program in adolescence. So as you may know, in the summer, kids may be less active, their sleep shifts, they watch more screens. And so I've actually thought about what would be the ideal 24-hour program, and it's really a summer program. It institutes routine. We would then be reducing potential, I say discretionary screen time. It would be facilitating physical activity and those regular bedtimes and wake up times. I also think for parents, it would help us out because then we wouldn't have to be going to camp over here, camp over there, and help us also have less stress, which also may influence some of those health behaviors as well. And what would, I think if we had this program, I would say it would be replacing screen time with physical activity, creating routines for the whole family, and also just a reminder to have a reward system that continues the behavior. So if we're being active, we want to do something like going on a trip rather than rewarding the physical activity with screen time. So the prize continues the behavior. But again, I want to emphasize that I've talked about a lot of stages, a lot of ages. We need support at all ages. I didn't get a chance to talk about adults, but there's another 24-hour transition, which would be menopause, which includes shifts in sleep, shifts in physical activity as well. We need support across all ages. And so though I've primarily focused on 0 to 18 or the first 2,000 days, we need help across, and we always need to work together, because when I work in first 2,000 days, I actually don't really work with kids. I work with adults because the adults are the ones that have the influence. But the bigger picture is that these are just individual programs and individual items we need support across at the bigger policy, the system, and the community and home, and really to work together because we all have the same goals, and let's figure out ways that we can come together to support kids to be healthy in the first 5 years and beyond. I want to also emphasize that, green space and community programming is a huge part of it. Kids can't be active if they don't have access to parks and other things. And I chose the picture I chose because in general, women are less active. We usually have different screen time preferences, but we also have a lot of changes in sleep. So one of the other big changes is to increase our access to physical activity programs and healthy options for girls as well. But what can you do? So I've talked a lot about a couple different things. Biggest thing is if you're a parent right now and you're, maybe reflecting, you're like, yeah, maybe we do a little screen time, or we have a lot of changes. Don't wait for the new year to make changes. Any change you can make, even just starting Monday, is a great start. And also remember, you can lead these things, and it's to look back on yourself about what are your screen time habits at night? What are your other habits for sleep as well? And you can lead that moving forward. Also, we're coming into winter break. Breaks are a good time to make change, and then they are ready to go for school. For practitioners, I think the biggest thing is to think about sedentary time and sleep if you aren't already thinking about it, and assess it, and thinking about when you provide recommendations, thinking about either increasing intensity of activity or replacing sedentary time with physical activity rather than, okay, I need you to be active this week. It's, well, what can we change to get that physical activity? Where are some buckets we can do? And I think we probably already do this, but really thinking about replacing the sedentary time to make it physically active. And for researchers, the biggest thing is assess all three and consider the guideline attainment within your population. And the context is very important for all these behaviors. So again, today I've told you about the home, the school, and transitions, and hopefully maybe spark some ideas or some interest, or maybe some ideas for collaboration as well. But I do want to end on probably one of the most important slides here in just a sec. And that's my acknowledgements. I get a chance to present this because I work with great people. I've been fortunate to receive great funding. I've had a supportive institute. I have great mentorship. And I really want to thank my community collaborators and everyone who's helped make these projects come together. It's not just one person, it's many. And also my co-authors are here for one of my abstracts. So thanks, guys. Just want to say thanks. But But the biggest and most important people actually can't put their name on this slide. Does anyone know who they are? Yeah, participants. We can't do research and we can't do programs without our patients or our participants, because that's who it's really for, to improve their health across the lifespan. So thank you again for your time. I look forward to your questions.
Questions? I'll start out.
Yeah.
So there's a couple questions in here. First of all, you showed it on the screen, but most people aren't familiar with it. Can you tell us again what the Canadian 24-hour movement recommendations are for? I know there's a couple different
ones. So 3 to 5 for 3 to 5 year olds, those are ones I'll start with. For physical activity, it's at least 3 hours a day of any activity. So this could be walking around, anything. 1 hour of that needs to be moderate to vigorous physical activity. So exercise like intensity. For sedentary screen time, I'm going to say this and a lot of you guys are going to be like, wow, it's 1 hour a day. 1 hour a day for 3 to 5. Most kids, I would say, is 2 to 3 in general. And then for sleep, it's 10 to 13 hours. That includes nap and overnight sleep. So that's one of the things with our studies is we always have to ask, what about nap? For 5 to 17-year-olds, it's 1 hour per day of MVPA, so moderate to vigorous physical activity. For sedentary screen time, it goes up to 2 hours per day. And then sleep is, off the top of my head, I believe it's 7 to 9, 7.0 to 9.0. Within that, that's just a duration, but it's also appropriate sleep hydrating and consistent bedtime and wake up time. So we don't want to see a 2-hour shift on the weekend. That's actually kind of against the guidelines as well.
Thank you. And so our federal government gives us physical activity recommendations, and you mentioned that different professional organizations have the recommendations for sleep and screen time. Do you see the United States moving towards what Canada and several other countries have done, and have the federal government give 24-hour recommendations like what you just mentioned?
I would like to think they are. It's really difficult. These guidelines, the way guidelines are made in the US is that an advisory committee reviews the literature and provides recommendations. And then the federal government reviews those and sees how they can enact them. I would like to think at some point we could all come together as a physical activity, sleep, and just even child development field. I think it's going to be kind of difficult because of the way we do it. And I think part of it is because the US, for instance, doesn't technically have 3 to 4-year-old physical activity guidelines. That's because they didn't feel that there was enough evidence for 3 to 4s, even though the World Health Organization and other countries have. So I think the way we make guidelines, it's not as inclusive and maybe, collaborative as other countries. So it will take quite some time, but I do think that the US has demonstrated within our US samples the importance of meeting all 3 guidelines. So for instance, there's a researcher named Russ Pate in the University of South Carolina who has done a lot of work in physical activity. And he has really, moved forward in 3 to 4-year-olds. But the short answer is it's going to take a while for the US, and because we're not as collaborative as other places. But I don't think that precludes us as community organizations or as researchers to come together to embrace such guidelines together. For instance, if you do provide screen time or physical activity within your program to meet those guidelines and meet those evidence-based practices. So, yeah. Yes.
You think just from a policy standpoint, if all schools kind of had adequate recess and PE in the day, you could easily meet that 60 minutes.
I think they get most of it. I think my guess is they probably get to 30 to 40, but we'll still need some stuff, still need some activities beyond that. The reason why I say is because when you're, let's say you had 30 minutes of recess. If you're a 5 to 7-year-old, you might only spend 50% of that in MVPA. So that's 15 minutes right there. PE is going to be helpful to build motor skills, which allow us to be physically active. But most of that might not be moderate to vigorous. If we could increase the moderate to vigorous physical activity in those and some of that programming, I think that would be helpful. But we do need sports. Beyond that, we need them to be accessible, and they also need to be not accessible, but also not always competitive based. Didn't we just do this Aspen report card and people just want to have fun. And so I think this really shows that we can do PE, we can do recess, and people need more sports throughout the week, and also to do it not just for competition. So I actually used to be a rower in a past life, and we had like a rec team. We had like a rec team and like a competitive team, and that's what we need to have, like a competitive team and a rec team. Also make it not at 8 o'clock at night and make it affordable. Because I think some of us who have small kids know that sometimes you do get into those sports, but it's at 8 o'clock at night. Was that impact your sleep and also parents' sleep as well? So, and that is something we can do. But I do think going back to your original question, that's a great step forward. And I think we need to advocate for that. That also reduces any sedentary time. Yeah. Yes, we're here.
So I'm from Louisiana.
Oh, yeah. Oh, no. Okay.
This was just there, for, Thanksgiving.
Okay.
One of the things, just growing up in Louisiana that I believe in, of course, you know, that was back then.
Mhm.
You know, I think, children, depending on where you are in Louisiana, gonna automatically get a lot more outdoor time.
Yeah.
You know,
Yeah.
it's just the environment is conducive for that.
Yeah.
You know, but I was just interested in knowing, how diverse was your, participant
Mhm.
population?
Yeah.
And did you see any particular trends in, you know,
Yeah.
any of the activities kind of based
Yeah.
on race?
Yes, that's a good point. So, and I think what you're, to provide some context, Louisiana has a lot different population as well. We have about 50% African-American, 50% white in all of our samples. For physical activity, I want to say for motor skills, it's across the board. Motor skills are low across the board. For our guideline attainment, so the home stuff I showed, it was a mixture of middle income and lower income, so we didn't see a difference there. Now, I think what you're getting at is that and one of the things we wanted to do with our childcare one, where we did the toddlers, it was predominantly white population. It was a nice early childhood center. I just want to say, it was a really nice center. And so that's one of the things I thought about, because we actually had a control center that had 50% African-American, 50% white. They didn't have as many resources, and they had a lot tougher time implementing it. And that's where I kind of thought, we need to do a little more than just providing a package. We actually had in our control center, we did this study in 6 months. Within 6 months, we had new teacher, new director. So that was a big eye opener, is that, you know, it can work in this great, you know, center that has all these resources, but how can we make this work in other settings? And so, yeah, that's a very important point. Thank you for bringing that up. Yes, back there.
What do you see as kind of your capacity for collaboration, particularly with childcare providers? Currently with the.
I have a lot. I love it. So yeah, I was gonna say I walked in. A lot of my work's been childcare, so I have a lot of interest in collaboration. Yeah.
In Wyandotte County, work for childcare providers.
Okay.
And things. So I'm
Yeah.
like, okay, let's get ours.
Yeah. Let's talk.
Okay.
Definitely. Robin.
Yeah, and you said it well. It seems like both just now and in your presentation that a lot of it seems very teacher dependent. I know that's been experienced with my kids. Some teachers within the same center really are proactive with outdoor play and physical activity, and others just are not. What I suppose some of that is like center policies.
Mhm.
But you also mentioned training, and are there existing trainings that you recommend to people? Is that a gap? I know we just had a big
Yeah.
training, so.
Yeah, and I think, so yes, to answer your questions, and I also want to provide a little context. I feel like those who have been in the EC sector, like 5 or 10 years ago, this wasn't as big of a problem. It's kind of more post-COVID. There's been a lot of changes. We actually did a study. It was a systematic review, and we looked at these policy, system, and environment interventions, and what was the number one, and it was the Go Knapsack program. I cannot emphasize it enough, because it's you get an assessment of evidence-based practices, and then you have, technical assistance. So I would direct you to that. That is probably the best resource, and it's across many states. The big thing I think about is policy. And so when we did this training, one of the things we added into it is the importance of policy. And what I think about the importance of policy, actually, I don't know if any of you guys ever like, worked in, for instance, food service or whatever, but when you go and you learn how to make I worked at Caribou Coffee. When you go to learn to make a latte, we all go through certain things and there's a policy and kind of a check. But the idea is that anyone can come in and follow the policy. So if someone brand new were to start, you would all follow the same training program. And so I think it starts from kind of the top of having that policy that, okay, if it's above 15 and it's with wind chill or whatever, we're going outside. And so it's having that policy that we're all doing the same thing. The other thing is to create the system that it can be done. And so we have the operational systems that, it isn't tough for someone to fit in 10 to 15 minutes as well. And then the environment is that make it easy for teachers to go outside, have some shade for them to sit under, make sure they have some things to play with rather than just a play structure. But if they have a lot of options to engage with the kids and you have created a good environment, it's going to be easy to go outside. So again, I have that example of like an open field. Let's go out and play in an open field. Like the teacher doesn't either. But if we have like a nice playground and then maybe some portable play options, we have things to help them make their job be easier. Let's do that. It does start with a policy though. I will say a lot of childcare centers are operating at the best practices. So it's like the state licensing standards are here, best practices are another level. So all of them have to meet certain standards to open their doors, but remember the best practices are a step above. So I don't want to say that childcare centers aren't doing the right thing. They all are following licensing standards. It's these best practices are just kind of a couple steps above to achieve child health. Yeah.
What's the, if, a child, ECE director, if you were meeting with them, what would be, your pitch for why they should try to achieve some of these best practices around physical activity? I mean, should they just do it because it makes kids healthier, or are there other things that you try to sell them on? You found?
Yeah, I think I think anyone who's in this area, we all want kids to be happy and healthy. And so I've been in childcare like 10 years, everyone who I meet, they just really love the kids. And so I think all of them are interested in their health. I think the big thing with physical activity is it solves a lot of problems. If we're more active, we have less behavioral problems. If we're more active, we're going to sleep better during nap, and that makes everything easier, even for parents, right? So physical activity solves a lot of those problems. And a lot of people, it's also a good selling point when people come to your center. Look at our beautiful outdoor play environment. Oh, this is amazing. I want my kid to play on that. So people love it. Also from a selling point. I also think it's something that, for instance, increasing time outdoors is it's another opportunity also for curriculum. So you can take curriculum outdoors. So you're not necessarily taking away curriculum time. It is another opportunity to do curriculum in a new place. Yeah.
I've got a question in the chat. I was
Yeah.
gonna ask, his name is DT. I think it's Darian. Would you mind asking your question and taking yourself off mute? Well, I can ask the question.
Okay.
Put it then. Do you know of any good resources for educational materials and content that's easily digestible and appropriate for the common person?
There's a couple different, depends on what age range you're looking at. Again, Go Knapsack is great for like early childhood professionals looking to improve their practices. The 24-hour movement guidelines if you just Google it for Canada, they actually have a lot of stuff in their PDF. They have a lot of stuff that's available as well. And then for families, there's a lot of stuff, especially for bedtime from the American Academy of Pediatrics. But I could always find some and send it to you guys if you want some as a follow-up and like make a list or whatever. So, yeah.
If you were gonna tell a program the number one easiest thing that they can do to become, to the most bang for their buck as far as child activity, what would that be?
Balls?
It could be balls. It could be keeping the balloon in the air. I think the easiest changes are, keeping the balloon in the air with safe space. Depends on your space. That's a tough one. If I were to give you like a physical thing, I'd say the wood stepping discs. I don't know what it is, but people love the wood stepping discs and they can change those. There's a lot. But the physical things I can think about is like the wood stepping discs and the Bluey the balloon. But I also think I don't know, It's tough because there's a silver bullet. Those are the initial things. Let me get a better answer for you though and send you one though. So
Not a spray chalk.
not spray chalk. No, not spray chalk. There's a question over here too.
I help support physical education teachers, and so the comment that Jay had made in your response, I'm wondering if you expand a little. Are you seeing a lot of policy that secures the recess and PE time? Because I'm in Wyandotte County.
Yeah.
And it is even though they're allowed to take 2 recess
Yeah.
breaks, the focus is on instructional minutes.
Yes.
So if a teacher's not meeting their
Yeah.
midday math, et cetera.
Yeah.
I see that at max, they get maybe 1 recess.
Mhm.
And right now it's 50 minutes of physical education per week.
Per
And
week?
that is cut down if the gym has also the lunch and they have to leave 15 minutes early so they can set up the tables. There's just a lot of, it's
It's-
the only policy is right now, once per week, and that is being cut into so that really they're prioritizing grade level planning. So
Yeah.
anyway, there's just a lot of.
Yeah. If I had $1 million, I would love to create some sort of curriculum, especially like K-5 that could be done physically active. Because that's what we also found in the toddler study is like, no one had a curriculum that could specifically be done outside. So you had to kind of bring something together. So if we could create a curriculum that meets standards and gets to that'd be physically active. But that's another, it's tough. And that's the other thing is, and to go to some of these questions is it's not one thing, it's a lot of things and it's getting the right buy-in at the right places. So it's really tough if and also having the outdoor space, because you said you have the gym, but probably that outdoor space around you can't really use or it might not be safe. So if we had a curriculum that could be active, we could do it in the gym. Let's figure out a way to do it. But I think you're right. You're bringing up a lot of real world problems that it's tough to solve.
No, but Rich from University of the. Do you know what university it is?
Let's see.
UNC.
Yeah.
He's on here and he suggested to go knapsack tips and material
knapsack.
library along with
Knapsack,
the active
100%.
kids.
Mm,
And he said he'd love to work on an outdoor play curriculum in the future.
yes. Yeah. Go Knapsack is a fantastic resource. Fantastic. And it's evidence-based everything. But I do want to emphasize that like there are a lot of people in this room who all have the same interests. And though, I hope this has also sparked opportunities for us to work together because we all have the same goal. And maybe we can figure out some other innovative ways to get across or to address some of these real world problems. Because it is that policy and systems and environment, which actually is a core tenet of Go Knapsack. So.
I think you hit on it a little bit, but do you know how it relates like physical activity with like behavior issues?
Yes, that's a huge thing. So it actually, kids who are more active have less behavioral problems, but we're also thinking, is it chicken or the egg? So is it kids who have more behavioral problems? Are you, because they have behavioral problems and they, for instance, use their screen time as a security device, do they get more screen time because that calms them down? We're actually looking at that in our next study, but in general, if you're more physically active, less screen time and better sleep, you'll have fewer behavioral problems, but I do wonder if it's chicken or the egg, because when you look at kids who do have behavioral problems, and something I want to emphasize is below 5, you can't be diagnosed with ADHD. And so a lot of these kids who do not meet guidelines are demonstrating symptoms for ADHD or other diagnoses, and they can't get diagnosed. And so I'm thinking of one instance we had in the study where they said, I can't take away his screen because it's a security item. And so is it, the behavioral problem, are they treating the behavioral problem with screen time, or is it the screen time that leads to it? We're not sure. But
Yeah.
I think it's a huge component. And then this leads into those who have behavioral problems might also not sleep the same. And so one of the things that we found is there's a lot of pediatric melatonin usage. About 25% of our sample is using melatonin in their 3-year-old. And so we're looking into that a little bit more as well. So, yeah.
Curious about that too, because I mean, most of those behavior kids, they'll use a 15-minute recess.
Exactly.
Because that's their reward for the day. So,
Yeah.
I'm curious.
It's
like what you said.
It's chicken or the egg. Yeah, it's a very important point. Thank you for bringing that up.
Another question? All right, let's get some physical activity and
Yes.
stand up and give each other a meeting. Thank you so much. Thank you so much, Dr. Crotch. Croc. I will also note, I had a colleague who did a randomized control trial, and they counted smiles during either a physical activity classroom break or like a coloring exercise. And the kids who were doing physical activity smiled like 25% more than kids who are doing the sedentary activity. So I think that they're happier too. And then the last thing I'll say is one of the things that has most impressed me with Dr. Kroc in the last year that she's been here is her willingness to seek out partnerships, both from other faculty members and other community organizations. So please, you have her contact information. You can grab her after this. Please feel free to reach out. Okay, we don't have a lot of updates, but we do have a few that we wanted to share from our group at the Kansas City HLC. The first are some Kansas City physical activity plan updates. We won't go through all of the 10 sectors that we have active, but we will highlight a few of them. Here are some upcoming meetings for 5 of the sectors. You can see them listed here. You can also find these at any time. They're on our website. Go to Kansas City or kcphysicalactivityplan.org and the Get Involved tab that shows our calendar with all of our upcoming meetings. So you can find all of that information there. One exciting update is the Business and Industry Group has spent the last year developing their strategies and tactics, and they have their 5 strategies that they've created. Strategies 41 through 45. You can see them listed here. I don't know, Natalie, did we want to go over these at all, or? I think we may have talked with them and talked about them in a previous meeting. But if you're involved in business and industry, this typically includes like worksite wellness programs. Please feel free to reach out to any one of us. Natalie is the sector contact for our group. So reach out to us if you'd like to get involved. Their next meeting is December 9th at 3 p.m. Early childhood, next meeting is January 20th. Do we want to make an announcement?
It's gonna be a fantastic meeting. We don't have our presenter yet, but it's gonna be fantastic. You should join.
Fantastic meeting on the books.
Oh, see, then it really is gonna be fantastic.
Okay, so from Johnson County Parks and Rec, nature-based learning director is going to speak. Is that close enough? Yeah. Well, we learned about how important and meaningful nature-based play is in ECE settings. So hopefully you can make it. Healthcare, as our healthcare sector lead walks out the door. Dr. Roberson, upcoming meetings listed here. Anything super exciting you want to share as in your parting words?
Yeah, there's a culinary medicine lecture that's going to happen at Children's Mercy and at KU in February 19th, 20th, please. I got the dates right. Thank you. So that's something coming up, and it'll be pretty cool. There'll be some hands-on little workshops after with some actual like cooking.
Great. So for those online that couldn't hear, there, in addition to the meetings that we have here in February, there is going to be a special speaker from UT Southwestern in Dallas, who's going to come and give a lecture on culinary medicine at both KU Med Center and Children's Mercy. The date is February 19th and 20th. Correct. More information to follow. What's that?
19th is KU, 20th is Children's Mercy.
Yeah,
and New York.
Yeah, 19th is at KU Med and the 20th is at Children's Mercy. So keep your ears open for more information on that. Right. The one sector that is not currently active within the KCPA plan is faith-based settings. So if you have any recommendations for who might be a good either individual lead or organizational lead for faith-based sector, please let us know. You can contact us, any of us from the HLC. Now's the time to share partner updates. So does anyone have any updates from your organization that you'd like to share with the group, either in person or online? And it can be something in December, it can be something in early next year, it can be something bigger just happening in 2025. Well, yes, Katie, please.
Challenge kickoff is April 11th. Registration is now open for organizations who would like to participate. Just wanted to share that. We're
Great.
expanding opportunity to participate in sport sampling as well.
So Katie, for those online, Katie notified us that they have set the kickoff date for the Kansas City Corporate Challenge, and that is on Friday, April 11th. And it'll be out at the Truman Sports Complex, as it always is. The Kansas City Corporate Challenge is one of the most amazing events that this city puts on each year. I think it's probably the best in the country.
Speaking about that, I think our business and industry sector is gonna do sports equipment donations again. So they're looking for both people to collect sports equipment donations as well as youth sports programming that need the donations. So if you would like to get on those lists, let us know.
So the additional update was some of you may remember that at last year's Corporate Challenge kickoff, we hosted a sport equipment donation at the kickoff event. It was kind of a one-time thing. It was very successful, and it will be happening again at this year's Corporate Challenge kickoff. So more information to follow. We will restrict the equipment items so they're very targeted towards specific organizations within our city, more than likely. So keep your ears open for more information on that. Likewise, we have been approached by external organizations in other cities that operate in other cities that they would like to make a permanent presence in the Kansas City region for sports equipment donations. Think of it like harvesters, but for sports equipment. So at any time you could donate your unused sports equipment to this institution. It would house it in a warehouse, and then it would be made available for free to qualifying organizations. So youth sports organizations, schools, for example. They're present already. The organization that contacted us is present in, I think, 4 different cities, Baltimore, Buffalo, starting in Atlanta, and another city that I'm forgetting. Ohio, yeah. And so there's interest in them coming to Kansas City. The biggest barrier right now is there is some upfront cost that needs to be made to get a warehouse and get some staffing. And so we're kind of helping them explore those opportunities. But if you or your organization has interest in this, please feel free to reach out to us and we can start having some follow-up conversations about that.
They're called leveling the playing field.
Yeah, Leveling the Playing Field is the organization that's been in contact with us. But it's a really nice organization, and I think
based on our Aspen Institute results, where we found that cost of sports equipment is a barrier to participation in a lot of cases. This solves an important gap there, important barrier.
You know, the way that program is set up, they take any volunteer.
It is almost exactly like Harvesters. So if you've ever been at Harvesters, they both take food and money donations. They also take time donations. So organizations can, spend an afternoon organizing sports equipment and cataloging it, things like that. So yeah, there'd be opportunities there as well. Like I said, the biggest barrier right now is the kind of upfront costs that would need to be addressed to get them started here. Any other partner updates? There will be, as Dr. Kroc mentioned, there is a national conference called the Active Living Conference that is hosted in a different city every single year. Typically, it's in places like Charleston, South Carolina, San Diego, California. This year, it is being hosted in Manhattan, Kansas, right in the middle of the country. This is like a very big deal for the Midwest to have this very important active living conference. It has both research and practitioner tracks to the program. So there will be people like Dr. Kroc speaking about her scientific analysis of ECE centers. But then there's also going to be, for example, Bike Walk KC, I know, is presenting on some of their work. The dates of those for that meeting is going to be it's like spring break.
March 16th through the 20th.
March 16th through the 20th. It's, an easy drive for a lot of us. You can register and just go for one day. So we've talked about it a little bit in the past. There will be more information about that conference coming up in the next coming months. I encourage anyone to attend. Any other announcements?
We have a few more resources shared in the chat. Felicia and Rich had Head Start uses Choosy Kids curriculum, and Rich ditto that was a good resource, as well as Dr. Diane Kraft's active playbooks.
Great. More resources are in the chat, and we'll send all of those links to all of those out in the post-meeting email communications. So you can find those there. All right. Thank you so much for joining us today on this cold and windy day. Please complete the evaluation. You can either scan it here. We'll put a link in the chat as well. There will also be an evaluation link in the post meeting email that we send out. There's also a paper copy on your agenda, or a paper copy with the QR code on your table, so you can do it there. We really value the feedback, both good and bad. The one that I mentioned a lot is people have some strong opinions about the food we serve. So please tell us things like that, and we're happy to make accommodations as necessary. We also are always looking for speakers for these meetings as well. So if you have an individual, or if you would like to present, please let us know. You can either reach out to us or add it in the evaluation. We do not have our next meeting scheduled, but it will be in March. We just don't have a date finalized just yet. So Thank you all for coming. We'll see you in sector-specific meetings, and hopefully we'll see you back in March. Have a great holiday season. Thanks, everybody.